Good evening, everyone. Thank you so much for joining us. This is season 2 of our Health and Humanities Fireside Chat series, and I'm so excited to have you all with us tonight. We're making sure all the socials are connected, so we're going to give everyone just a few more minutes, and then we are going to dive right into the show. So, wherever you are joining us from, we want to thank you for tonight, but we will get started here in momentarily as we again just make sure that all of the social media accounts are connected. We love technology, especially when it works. But thank you for joining us. Give us just a second. All right, family. So, again, thank you all so much for joining us wherever you are joining us from tonight, whether that's on Facebook, on YouTube, on LinkedIn, on Instagram. We are just so excited to have you with us again. This is season 2 of Health and Humanities Fireside Chat. For those of you who are joining us for the first time, welcome. My name is Pamela Price. I am Deputy Director of the Balm and Gilead, and I am your gracious host for this series. And this series was created last year because we wanted to carve out some space where we could center the lived experiences for those of us coming from communities that are often underserved, underrepresented. So this space was created with the intention of moving us past just kind of what the data tells us, what the statistics are always putting in front of our face and letting us know, but really to dig into the lived realities for how the data is showing up in our everyday lives, how the research that we hear shows up, how the disparities and inequities are actually showing up, and more importantly, not just how they are showing up, but what we are doing, what different organizations and leaders in our communities are doing to actually address those, and to address those from a perspective that looks at our entire humanity and not just one part of it, but the entire system. And so, again, I want to welcome you all. A couple of housekeeping things. This conversation is not just about us or me and our guests, but it's also about you. And so we want to make sure that, again, wherever you are joining us from, please make sure that you connect with us. So whether that's a comment, a feedback, if you have questions, because we will definitely make sure that we have time at the end for questions. We can hopefully even bring some of those up onto the screen with us. But yeah, please make sure as the conversation goes along that you let us know what you're thinking, again, about what we're talking. If you have experienced anything like what we may share, again, you just have comments and your own input that you would like to share with us, please do not shy away from that. We welcome that. And without further ado, again, it's a fireside chat, and I just don't want to sit here and talk to myself. So I am very excited for the first guest for this season to be the beautiful, amazing, passionate Reverend Dr. Lakeisha Cook.
Good evening.
Hi, thank you so much for just saying yes to tonight. Um, and for those of you who don't know, I'm going to let her introduce herself and give her bio because it's quite extensive. She is just an amazing human being. And the work that she does is so important and critical to all of us. But Reverend Dr. Lakeisha Cook, she is the executive director for the Virginia Interfaith Center for Public Policy. That this center, which I have really humbled to be a part of a coalition, really focuses on that intersection, much like the Balm and Gilead, that intersection of faith and public health. But they're doing it through that lens of public policy, which you all know how strongly I feel about us engaging in public policy. And so, again, I am so excited to have you with us tonight. And I want you just to tell the good people who you are, a little bit about yourself, and then we'll get into our first question of the night.
Okay, sounds good. Pamela, thank you so much for the invitation to share this evening. I'm really grateful to share virtual space with you and share space with you And grateful that our paths have crossed. You know, when I was able to see you at the General Assembly a few months ago, my heart was overjoyed because I hadn't put my eyes on you in a minute. And part of the power of this work is the collective community that stands behind the work that we do. And so just grateful for your presence. Who am I? If I were to introduce myself, the way that I normally lean in is through the framing of the Maori people, who are the indigenous people of New Zealand. When they meet people for the first time, they believe it's important to learn three pieces of information. Learning a person's place first. What's the place that a person considers important in their journey and the place where they find themselves? Then a person's name, and if there's a story behind their name, and then a spoken intention. So if you're coming into someone's home for the first time or you're meeting a person for the first time, really saying what is it that you're seeking to bring and what is it that you're. And so I'm just going to frame my introduction that way a little bit, and I'll keep it short. But my place, if I had to name it, where I find myself right now, where I'm grounded physically, is in Richmond, Virginia. Richmond, Virginia is my place because it's where I live with my family. Richmond, Virginia being the home of the indigenous stewards of this land, the Chickahominy people. I acknowledge them. I acknowledge their blood and sweat in the soil mixed with my ancestors. But Richmond is my place, not just because I live here with my family, but Richmond is my place because I'm a proud graduate of historically Black College University that's here in Richmond, which is Virginia Union University, is where I got my bachelor's and my master's degree. So Richmond is my place. Another place I always call in because it's connected to who I am is my hometown of Upper Marlboro, which is right outside of DC. I'm from the DMV, not the Department of Motor Vehicles, but DC, Maryland, Virginia area. I'm from the M. And so that's home for me. So I am connected up 95 and down 95. And so Upper Marlboro being my home, and that also gives me a connection to my name. My name is LaKeisha. My K is capitalized because my parents say so. I was born during the age of Keisha's. One of my college professors, actually seminary professors, said that. And I was like, yeah, you know what? I had about five Keishas in one of my classes during one grade in elementary school. Two LaKeishas, a Takesha, Nakesha, and Keisha. So anyway, Keisha is my name. Can't find it on a keychain when I travel. Can't find it on a magnet. But I find my name in my community. So my name is connected to my community. Middle name Cherise, that's connected because my parents have given me that name, but my daughter also carries the same middle name, and she connects me to my greater purpose and my intention in sharing space tonight. Purpose to make this world better, not just for me, but for her and those that come behind us. And the intention for tonight, just to share a little bit about the work that we do at Virginia Interfaith, to share how I got into the work, to share the power of the work.
Yes.
And when you have the collective community really singing the same note as far as what justice work looks like, anything is possible. So my intent is to share from my heart, from my experience, and just, whatever I can give in this space. So thank you again for having me.
No, thank you again for joining us. And I love that. I too know a lot of Keishas. The Balm and Gilead have we have our own, the amazing Keisha Curry who keeps us all together. And I love that too that your daughter, you guys share the same middle name because me and Bryn also share the same middle name. So my youngest daughter has my middle name as well. That's so awesome. See that's
Mhm.
why, you know, kindred spirits indeed.
Yeah.
So again, family, thank you all so much for joining us for tonight's conversation. Again, if you hear something that you like, that resonates with you, again, we definitely want to make sure that you are interacting and engaging with us throughout the chat tonight. And again, we will make sure that we have time for some Q&A. But without further ado, and we got a lot of questions. Sometimes we get to all of them, to be honest. Sometimes we don't. Just depends on kind of how rich things go. But we're going to kick it off with the first question here. And do you have a preference on what I call you? Because I know we see each other, so I want to, you know,
Keisha,
okay,
please.
okay.
Yep. Yep.
So, Lakeisha,
Yes.
your work lives at that intersection of faith, policy, and community, as we've shared. And so, how did your journey, your lived experience, lead you to this particular calling to really stand at such a pivotal crossroads in terms of our faith belief and traditions, and how policy and advocacy marry come intersect with those things?
I have named one of the important places for me in my own journey was Virginia Union University. Virginia Union really helped to water the seed of justice work and advocacy work. I was a sociology major as an undergrad on that campus, and the brilliant minds that I encountered there, and the political science classes. I always speak the name of Dr. Eric King. He was one of my favorite professors. He taught a political science course that just it piqued my interest in a way that interest hadn't been piqued before. Like he introduced me to minds like Michael Eric Dyson and Manny Marable, and like I was reading works that just resonated at a really deep place with me. And so that began like to kind of again grow this desire and this love for justice work. But after graduating Union and grad school there, I moved to Arizona to work for a church. And I will say that was a pivotal part of my journey with really understanding that true intersection of not just faith, but local congregation ministry and the work of policy. I had the honor of working for Dr. Warren Stewart at First Institutional Baptist Church. And Warren Stewart was one of the lead champions in getting the MLK holiday recognized in Arizona. For anybody who knows any history of the MLK holiday, Arizona was the last state to decide that they wanted to acknowledge the King holiday. And Dr. Stewart was right there on the forefront of the fight. And so going to work for him and sit at his feet and learn at his feet about really how the work of justice and policy and advocacy intersects with that local congregation life at a very pivotal part of my development as a young adult, a young person in ministry. It just became the foundation of all the work that I do. And so there's that common thread that went through with my work at Union, going to Arizona. And then when God led me back to Virginia, I did local congregation work for a while, but then God opened the door to work at Virginia Interfaith. And all the pieces, all the intersections just all came together in this really beautiful way. And so, where I was really used to doing like a singular local congregation justice work, what Virginia Interfaith did, it expanded my understanding of justice work of, yeah, one church can do a whole lot, but when you have multiple congregations and multiple houses of worship and places of faith coming collectively together, we can do so much more.
Wow, wow, wow. So, for those, and again, this is why, like, I love what you do and how you've gone about, like you said, making this interfaith and really, I think, understanding not both the historical role that our churches have played, but I think it's like you said, how, what it looks like collectively when we can bring our faith communities together. I think especially in a space where um, we have had those successes, like championing to make sure that MLK Day became, a national, holiday. Whether it was from, our churches being the first ones who said, well, if our children aren't going to be able to get a public education, we will fund and find ways to get them educated. So I love that you have been able to draw on all of that in your path and now in this work. So for those who may not know who or anything about the Virginia Interfaith Center for Public Policy, can you tell us a little bit more just about what the mission of the center is in terms of its advocacy, how it is really rooted in those faith values, again, and for those who are unfamiliar, and to kind of paint that picture for us?
Sure. So the mission of Virginia Interfaith, we engage people of faith, but not just people of faith, people of goodwill. We're really intentional about naming that in our mission because there may be people who don't believe in organized religion, but they believe in the work of justice and they see what we're doing and they want to jump into the work with us. So we want to engage those people who believe in the work of justice and they really want to see the advancement of justice for all Virginians, whether it be socially, economically, or racially. And we want to see the advancement of justice, not just in Virginia's policies, but in the practices. Like, how is that really lived out in community? And so we do that by education, we do that by leadership development, we do that by community mobilization. Like we have a lot of strategies that we use, but we really want to find those things that people of faith can all kind of garner their energy and their voices around so that we can move the work of justice forward. We do ground our work in faith based advocacy, meaning that we want to ground that work of calling for justice coming out of a person's faith. And so, where our faiths may have differences of beliefs and even what worship styles may look like, there are some commonalities that we can find across different faith communities and faith traditions, like focusing on the love of neighbor, like really making sure that this isn't about just you being able to live and thrive, but we want to see everyone being able to live and thrive. I personally, one of my philosophies that I live out in my personal life that shows up in my professional life is this concept of Ubuntu, this African concept that means I am because we are. Really understanding that I am not fully human outside of my connection to you. So it is not just enough for me to win if we're not all collectively winning. So faith-based advocacy really being grounded in that love of neighbor and really engaging people out of their faith and speaking and acting in love. Because again, that's the common theme throughout any faith system that you see. Love is something that you always see showing up. And so, how do we ground the work of advocacy in a way where love becomes the centering point and the foundation that we build off of? And so, we ground our work with faith communities that way. We believe that everything that we do, it starts with civic engagement. And when we say civic engagement, it's about the education of, what does it mean to register to vote? How do I get to vote? What's on the ballot? Once I understand those very vital components, then it's about mobilizing people and getting them actually to go out to the polls. Let me just name today is election day. Polls just closed at 7 o'clock. So hopefully everybody went early and voted or they went today, because again, it's about using the power of the voice of our vote and educating our congregations to push people towards that. So it's not that we need our congregations and places of faith to tell people how to vote per se, but can you just encourage people to vote? And educate them about what's on the ballot. I could talk forever, Pam, but I mean, it is
Us
like
both.
I know, I know for a lot of people, they'll go vote and they don't even know what's on the ballot. And this
Right.
isn't a critique. This is just real. Like when I was
Right.
outside of doing this work, I didn't always know what was on the ballot. I knew I was
Right.
supposed to go vote, but to know
Right.
ahead of time all the things that were on the ballot, we
Yeah.
might know the people who are running because there's signs everywhere.
Right.
But they'll have different questions, different initiatives, different ballot
Yeah.
referendums that show up, and sometimes people just don't know, and so they're
Right.
walking up to vote, and people are handing them a bunch of literature, and they're trying to like process it like quickly so they can
Right.
get it and make a decision. So for us, we're like, how do we resource people early? How
Yeah.
do we give resources to pastors? How do we give resources to faith leaders so that they can educate their congregation and then get
Yeah.
people into the voting booth? And then once we vote people in office, here's the
Right.
key: holding them accountable to do the work of the people. So
Yes.
making sure once I put you in office, please make sure you're speaking on my behalf. So that
Right.
means I've got to engage you. I've got to come to your office. I need to call you. I need to email you. I need to show up as much as possible so that we're holding people accountable. And so our role as an
Yeah.
organization is to educate, train, resource, and
Yeah.
give people that type of those additional tools so
Yeah.
that, in the work of justice.
So much that you said, and again, I get really excited. I was like you, like this is a topic that if we could ever find a common thread of something that impacts every single facet of your life,
Yes.
policy is it.
Yep.
There's no area in your life, no matter what income you have, no matter what community that you live in, there's no area in your life that policy is not involved to some
Yep.
extent. And so I love, that aspect of it, is that it is never about someone trying to own your vote and tell you again how you should vote, but it is those voices who need to continue to encourage us to vote, the power in that. And I
Yeah.
think being educated and informed. Because
Yes.
even when you see those signs, if you haven't gone to their platforms or their websites or been following them, you have no idea what they are saying. They're going to go to to your state capitals or to our US capital and do on our behalf.
Yeah.
And that's also how we know if we say, well, that's not what you said. You got in and that's not what you said. And we're going to need to make sure that you do what you said,
That
you
part.
were going to do. I think it's always understanding that power dynamic that somehow I feel like it shifted. That no, they are the ones that are in control and we have no control. And it's
Yeah.
always the lesser of the two evils and those types of conversations. And
Yeah.
I love that the Virginia Interfaith Center is that you guys are there, like you said, you're equipping communities to say, no, this is all the resources. You can be an informed voter, however you decide to vote, but you're going to be informed, you
That
know.
part.
So
That part.
I love that. I went today. I'm one of those. I love a day of voter because I
Yes.
like to see who's out and about the day of
Yes.
a major vote like we had here in
Yes.
Virginia. And I hope everyone was able to get out and make their voice count,
Yes.
whatever way that you voted. And I
Yes.
also just want to also just give you kudos um, because I want you guys to know that Lakeisha and her team, anytime I've gone to our capital here in Virginia, I see them. Most, if not all, of those legislators know they're familiar with her team and her staff, walking those halls. And it's such a stark contrast to when I go to our nation's capital and I'm doing briefing or having meetings, and I don't see enough of us represented.
Yeah.
So I want to give you those flowers now to know that we see you doing that work. And what we hope to do from tonight's conversations like tonight, and hopefully just again continuing you. If you guys missed her at our conference this past year, you missed out. You got to go and go back to bombmcgillit.org and reach out to us because we also again you blessed us during our conference as well with this information. And so again, I just want to give you those flowers and thank you for that. That she is really, she's about this policy life family. This is not lip service. I see her in there all the time, all day, and her staff. So I want to thank you for that. So I want to shift us a little bit because, again, we know we had a major vote here in Virginia today.
Yeah.
We know we got bigger, midterms coming up this November. Um, so we are definitely living through a period of kind of significant policy disruption or policy inadequate policy, failed policy, no policy. When it comes to things like Medicaid, public health funding, and how those debates have shifted, both state, because I hope y'all understand whatever's happening here bubbles up to what happens in DC and in our federal policy as well. So, don't make the connection that I can engage at my state level and forget about the federal level or the county and not forget about the state. It's all connected. But what are you seeing as the most immediate or urgent threats to health equity in this current landscape that we're in right now?
It's such a question, because there are so many things that are happening simultaneously. Um, but I think one of the biggest threats that we're facing right now is the collapse of the ACA marketplace, and the coverage there. When Congress made the horrible decision to not extend the subsidies for people who had enrolled in ACA and those ACA premium subsidies went away, um, it has had catastrophic results already. So we're already seeing a drop in people enrolling in ACA coverage. That drop will possibly continue. We're watching as premiums continue to rise for those who were already under the coverage and already engaging in the marketplace. And so you have people who are having to make the really hard decisions of, am I going to keep paying for healthcare or am I going to keep food on my table? And so people are having to make these horrible choices that no one should ever have to make. And so for a lot of families, they're having to make the really hard choice of letting the healthcare coverage go. That's a public health crisis in the making. And so, to watch this happen in real time, and I think too often those people who aren't using those types of services believe that this may not impact them, but the impact and the ripple effect is inevitable because private insurance, the premiums are going to start going up even the more so. So we're also going to feel the impact of that policy shift. Now, what I appreciate, because Pam, you named it, all of the federal, the state, and the local policy pieces are all interconnected. So when something happens on the federal level, so those cuts happen, the decision happened on the federal Congress, we're feeling it on a state level. And so what the state legislature has done is they're trying to figure out a way to meet that gap that is now there. And so how do we, put some money in place that can hopefully help to give some relief to the people who are feeling the crunch with these rising premiums. But now this week, I mean, we know that they're in budget talks. And so we don't know where the state budget is going to end up. And there are a lot of competing priorities in the budget. Health is not the only thing that has gotten cut. And, so as our wonderful legislature is trying to figure out how do we get a balanced budget and how do we give some relief to people, it's a difficult process, but I'm appreciative that they're at least trying to come up. They've come up with a solution that they've put into the budget proposal. So hopefully it'll end up there and the governor will sign it so that we can see some relief there. But again, if I had to name the first and the biggest thing, it would
Yeah.
have to be that, because that's again just catastrophic and it's a setup for a public health crisis.
Yeah, and I love that you pointed out too that for those who you you're not on ACA, you've never been on a health exchange plan, you maybe have your own private pay, and oftentimes, like you said, those groups of individuals feel like that's not an issue that's important for me to pay attention of. I have no skin in that game. But like you said, we all have skin in that game because somewhere that gap has to be shored up.
Yes,
And time again, we've seen that when those cuts happen, someone picks up the tab and it is never the people with the deepest pockets.
never, never.
And so it's
Right.
always those of us who are somewhere in the middle, those of us who are still, like you said, those of us who are making those hard decisions on whether or not I'm going to keep my insurance or whether or not I'm going to put food on the table, which is also, the cost of food is going up, the cost of rent and housing is going up. It's sad when we get excited and do a praise dance because gas hit under $4. And I was like, whew, you know,
That
but
part.
in hindsight, is that really something to be shouting about? Because even that is exceptionally high when you think about our cost of living and how
Mhm.
health not being able, delaying getting care and
Yeah,
turning something that could have been minor, could have been prevented, could have been taken care of ahead of time to
yeah,
something that is now, a six-figure hospital bill, is like you said, it's catastrophic. And
yeah,
so I think yes, we are fortunate here in Virginia, like you said, that we have legislators who are really trying to shore and close that gap up. But like you said, with so many gaps being created by what's happening federally,
yeah.
inevitably something is going to get left out.
That part.
When the budgets, go through. It could be education because we've seen, same
Yeah,
thing federally,
yeah.
edu, you know,
All
education
of
at
it.
our federal level is under attack and completely being, gutted and dismantled and leaving
Yeah,
states to their own, um, own devices. And
yeah,
so that again, I think just, hits home how important having advocacy, how important having this education and being informed, why it matters so much. So
yeah. Can
in
I
thinking,
name can I name one more thing?
yeah, no, go
I'm
ahead.
sorry,
Yeah.
because I want to celebrate like the work that Catherine Haynes specifically on our team because she's our health equity manager. A
Love
piece
Catherine.
that we were able to do this session that actually is going to become law is increasing funding options for schools to be able to get school nurses in the
Yes.
schools, where there was this at-risk funding that could be used like solely for certain positions within the school system. And
Yeah.
so there was a bill this session that said, hey, we want to add school nurses to the menu. So if
Yes.
schools want to access at-risk funding and use it for school nurses in the schools, they'll be able to do so. So because Catherine led on that bill, our people supported that bill passed, governor signed it. Now we would at least our children, as we're looking
Right.
at what's happening, with the ACA subsidies, Medicaid
Hmm.
cuts, at least when our kids go to school, they may
Right.
have an option to be able to see a nurse that will be able to
Yeah.
provide some type of medical care and support. And so I just had to shout that out because it's bills like that that help to fill the gaps.
Yes, and and definitely, I love Catherine. I've worked closely with Catherine. It was Catherine who reached out and said, "Hey, look, can you come up here to the General Assembly? We got some things that I know we had been tracking in terms of the anti-bias legislation." And again,
Yeah.
you know, this is family. Again, I want you to, if you do not know, please make sure that you reach out. We're going to make sure you have the information so that you can get connected to the Virginia Interfaith Center. But I want you to I strongly encourage you to do that because, again, the more volunteers, the more people that organizations like the Virginia Interfaith Center can have to put, boots on the ground, so to speak, but to be able to not only just show up and advocate on behalf of Bill, but to actually share your story, to be able to say, this is how this policy that currently is in place, or maybe it's not. And because we don't have a policy that addresses this issue, this is how this has hurt me, harmed me, impacted me in some type of way. I think, again, our stories matter. And so if we look at what gets passed, what gets signed into law, and if you look around your states or you look around wherever you're joining us from and you're not seeing legislation that is representative of that, it could be because they're not hearing your stories. They're not hearing our stories. They're not seeing our communities. When
Yep.
you want to know how a highway can come and gut straight up through a community, they did have to ask somebody.
Yeah.
The problem is when they asked, the only people who showed up were the people who said, "Yay, we're in favor. We believe this is going to be great for the economy." And the people whose communities and homes were going to be devastated did not. And there's a number of reasons why, in terms of, again, who gets access to that type of information. But I strongly encourage you to take an opportunity to get connected to the Virginia Interfaith Center. To know, about, again, all the bills. That's one of the things. If you're a person and you're not in this work and you don't have time to look up a bill or keep track of bills and legislation, come to an organization who is doing that for you and to give you and equip you with that information. So I just had to, yeah, thank you for that shout out for Catherine, because she is just amazing, and another, again, godsend.
Yeah.
um so as we I want to shift, even a little bit further. So there's often, sometimes, I think, a gap between what policymakers intend, right? So when a
Mhm.
legislation goes forth and this is what we thought was going to happen to it, and then what communities actually experience as a result of, said policy. So how do you, either as an individual or just even as the center, how do you guys kind of navigate that, specifically thinking about how the advocacy part of what you do goes into that?
I appreciate this question, because I think a lot of times there is a huge gap in, again, what you name the policymakers might intend and what actually happens on the ground. And so making sure, and you already named it, that people's stories and voices are heard and centered in an intentional way. I want to name one of the good things. There wasn't a lot of good that came out of 2020, but one of the good things that came out of the pandemic, the state legislature, it used to be where you had to go in person to testify for a bill. But when they had to go fully virtual in 2021, what they did is they maintained that virtual option for people because a lot of times the committee meetings, which is where people can speak up and talk about how policies impact them and what they believe about a particular piece of legislation, you can do that from home, you can do it from work because they now have virtual testimony. So again, that centering of people's voices is so huge. And so we always encourage people sign up to speak. They give you the option. And so if we don't say anything, then it becomes difficult after the fact to be like, well, I didn't know this was gonna happen, and this is how I felt about it. Okay, but we have opportunities, to speak, and it is difficult. A lot of people don't have that flexibility in their day. But even if you can't sign up to speak virtually, you can do written comments, and they do read it. And that emailing, phone calling, visiting legislators, we tell people all the time. Yes, it's amazing when you come during General Assembly to talk to your legislator that you have voted into office, be it your delegate or your senator. But another powerful time is after the session, during the spring, the summer, the fall. Sign up to go see these people in person. They are absolutely moved when they hear from their constituents. That is the most powerful voice when it comes to the work of advocacy. They listen to their voters. And so for us, we know that. So we create like moments like Day for All People in January. We have one day of advocacy where we say, hey, people of faith and goodwill, all come to Richmond. Come to Richmond. We're going to go through some workshops. We're going to educate you on some stuff, and we're going to schedule meetings for you to go talk to your legislators. And so we had like 430 people who came that one day. And then we had a day for college students to come, Student Day of Action. So, same thing. We're educating these college students. We're saying, look, these are some legislators they need to hear from young people so you can tell them what you're thinking about. And so, it is the moments that organizations like us create and other groups do lobby days all during the General Assemblies, but also taking that personal initiative to make sure that you are making your voice heard. Because again, it's about those community voices that will help close that gap between the intentions of pieces of legislation and what's actually happening on the ground in the communities.
No, I love that, and I love that you are making sure that our young folks are getting involved. I again, we cannot stress that enough. Eventually, they are inheriting, the broken systems that we have now, and we have to make sure that they are involved, to also help figure out what it looks like. I think there's so much, like you said, now that has been, it's been fragmented, or things that are have been put in place that they actually were not um implemented in a way that you got to see the good perhaps that they thought it was going to be. And I think, I was talking to my younger kids today. They, went with me when I went in to cast my vote. I was like, hey, this is, what ballots look like. This is what it goes in. This, and this is why this is so important. Um, and had conversations with them. And like I shared with them, I was like, you guys, why this is so important is that what we are doing today, I said, is going to determine, I said, I know you guys hear that. What you do today is going to determine, your future. I said, but it really is. I said, and we're at a point now where, you know, we will have to decide, do we build it back the way that it was? Or do we build it the way that it was supposed to be, or the way that it
Yeah,
should be? Like
right.
I told him, I said, I think that's the question that we are going to have to start asking in these next, 2 to 4 years, because we already saw the tearing down of things, but now once we do start the rebuilding, like
Yeah,
you said, how are we making sure that what gets rebuilt
yes,
does exactly what we want and intend for it to do, that has our collective voices, centered on that. I love the quote from Zora Neale Hurston, who's one of my favorite people, and she she tells us that if we don't speak up about our pain, they will kill us and say that
mhm,
we enjoyed it.
that part.
And so we can't remain silent about,
Yeah,
and not just the bad. It could be a legislator who fought and championed, and maybe they went against the grain, and they were that deciding vote on something that maybe their peers or maybe their party was against. Even championing them to say, because you voted for that, because that was able to go into law, this is the good that I saw from it. So I think not always taking to them how bad and horrible it is, but when they
yes,
finally do something good,
yes,
let's also thank them for that.
yeah,
That is their job. And that
yes,
means that, like, okay, we made next time you're back up on the ballot for us, I'm going to remember that, and hopefully they'll remember us when, when we go back to their
Yeah.
offices or interact with them. So again, this it's a
Yeah.
relationship that
It
we need to
is.
build with our legislators.
And I'm so glad you named that, saying thank you and expressing appreciation, because I think that's so important. Because a lot of times we always want to lead with the ask,
Yeah.
but telling somebody thank you, it can move mountains. And our legislators are people too. They're
Yeah.
people with families, some of them with really young children.
Yeah.
They don't get paid a lot of money to do this, and they're
Yeah.
working really long days. And yes, we have voted them into office, but they in a very short amount of time are responsible for thousands of pieces of legislation.
Yeah.
The grind of that session is
Yeah.
indescribable.
Yes.
And so, for those who are fighting the fight and really doing things that impact our community in a positive way, we
Yeah.
need to make sure that we are screaming from the rafters, thank you, every
Yes.
opportunity we have. So,
Yeah.
thank you, Pamela, for naming that. That's so very important.
Yeah. Because some you see them and like, oh wow, you really, you again, you stuck your neck out. Some things that seem very common sense, I think, to us here in the community, when you start trying to, like you said, roll that up into a law that,
Mhm.
has to be agreed upon by, the majority of people who, same thing, they have constituents or folks in their districts, and their districts may not agree. And so
Yes.
they're, but again, I think it is the, well, which voices, you know am I hearing, and is it a way for me to center all of them, so that when I'm going into session, I
Yes.
have a good pulse of what's
Yes.
happening, and I also can remember that I went, and those members who came and met me at my office to thank me
Yeah.
for something that maybe it was a little bit difficult, because it was not the pretty fancy, a celebrated thing to do. So
Yeah.
yeah, cannot stress that enough again. And I'd love to hear too, for those of you, again, who are joining us, like in the chat, if you have ever visited or spoken with or reached out to your legislator. Do you know who your legislators are? I'm really big to ask people that. Do you know which district that you sit in here in Virginia? Do you know who your local, congressmen are? Do you know who our two senators are? And because I think we learned some things even from, from 2024, that there's definitely still some civic 101, I think, lessons that our communities need to have to even know how our governments are structured, both at state and federal levels. And so that is also work that I really love that you guys do in terms of like just that educating. But since we both have, our organizations both are centered, our heart of our organizations is our faith communities. Um, and we know, like we mentioned before, that historically they have been at the center of these social justice movements, whether that be from civil rights to immigration to education, all of those things. How do you see the role of our faith institutions in this current health justice movement that we're in? And do you believe there are any areas where right now we may be falling short?
That's another good question, Pamela. Um, hmm. I think our faith communities as a whole are also juggling a lot of competing priorities and really trying to figure out what their role is in this season, particularly in the fight of justice. I
Mhm.
think for a lot of faith communities, it's been drilled in so hard into people's head, the separation of church and state. And so there may be an apprehension to even say the word policy and politics, within worship settings. Um, and so you kind of deal with that anxiety and apprehension sometimes. But for those that want to be involved in the fight, it can sometimes get a little tricky to find the things in which we can all put our collective voice around. Um, and the example that, comes to mind for me is like this fight about reproductive justice, like specifically here in Virginia. For a lot of people, when you say the words reproductive justice, they automatically go to abortion. And for a lot of faith communities, as soon as you say the word abortion, it becomes this polarizing topic where either pro life, pro choice. And so to collectively get your voice around it becomes very difficult. And so it becomes another opportunity for education to really talk about what does reproductive justice mean. As we know, this is going to be on the ballot coming in November. What are all the things that really fall under this umbrella of reproductive justice? Um, and so I only use that for an example to really amplify the need for education, like really being able to educate faith communities if there's an openness to education around like some of the key issues that we see are really impacting people in a major way. And really helping faith communities to understand what role do they have in the fight of justice. I was last year sitting in a discussion about public health, and somebody used the waterfall analogy to talk about public health. And as soon as they were talking about this analogy about this waterfall, like it resonated with me in such a major way. I'm a Baptist preacher, so you give me an image, I'm automatically going to like start making connections on this image. But if you're unfamiliar with public health conversation about the waterfall, it is a story told about a waterfall, people standing at the base of the waterfall, and they keep seeing people fall over, and they're like, wow, people keep falling in the water. Wow, we need to help the people who keep falling in the water. Like they're drowning. Let's do something to help them. And so the people at the base of the waterfall just start doing all of these things to try to help the people. So for me, I make the connection to congregations, how they show up in faith communities, sometimes in the work of justice. They see people falling over the waterfall and they're like, yo, we need to help them. Like they're drowning. Let's do like a, a a float drive. Let's have everybody bring floats to church on Sunday, and then we're gonna give floats to people so that we can help them in the waterfall. Or
Right.
they'll do like a prayer service. Let's all do a prayer service. People are drowning. Let's pray for the
Right.
people at the bottom of the waterfall.
Yeah.
But finally, somebody will have the idea of, well, hold on, why do they keep falling over? And then there's a recognition that they're not just falling, somebody's pushing them. And
Yeah.
so then there's a call not just to the base of the waterfall, but to the top to really figure out what's happening with this push. And
Yes.
I think a lot of times congregations and faith communities get stuck at the bottom and they
Yeah.
forget that there's also work at the top. Like, let's figure out this system of push that's
Yeah.
impacting people and not just figure it out from this removed place, but actually get close enough to the water to get a little wet to
Yeah.
find out what's really happening in this water and why is this system set up so people keep getting pushed on
Yeah.
intentionally
Yeah.
overboard. And so
Oh,
for communities, faith communities to figure out where's your call. Because I'm not saying nobody needs to be at the bottom doing work. I believe that
yeah.
there's a call at the bottom, but I also believe that there's a call
Yeah.
at the top. And
Yeah.
for us at Virginia Interfaith, we want to resource you at the top of the waterfall.
Yeah.
We want to help you understand we need to figure out how do we disrupt this system of the push.
Yes.
And, oh, I'm going to name this Pamela because I think this is so vital. What we can't do is stand from a removed place back away from the waterfall and create a solution without talking to the people experiencing the push because that's problematic. And that's
That part.
so often what happens. We're like, oh, a push is happening. I know a policy solution. Let me come up with, I know how to fix this.
Right.
That's problematic. And there's no integrity in that approach.
Right.
You got to get wet and you got to
Yeah.
allow the people who are getting pushed to be a
Yeah.
part of coming up with a solution.
Yes.
And so for faith communities, they got to figure that thing out. You got to do not just the base, but the top too.
Yes. First of all, I love that analogy. Love
Thank
it,
you.
love it, love it. Have never heard that. I
Okay.
I I think it fits perfectly, as you said. And yes, we need to start asking why are people getting pushed off the waterfall and landing down here and drowning in the stream in the first place?
That part.
Wow. No, again, I could talk to you forever. That I could talk about policy and all that we have going on forever. Again, thank you guys for joining us. We have folks from North Carolina, from Oklahoma, Mississippi was in here tonight. And again, I can't thank y'all enough for that. Before we open it up, if there are any questions, but I wanted to, I'm trying to figure out how to put a bow. There's been so much great conversation tonight. But if we um so eh, if we wanted to give space, or to have you give space, and you could speak directly to those who are most shaped by our policies and some of those that we've discussed tonight, and having to navigate these difficult systems right now, that don't have the resources or support. what would you want them to know and what would you want them to do?
Oof. What would I want them to do is to continue to hold on and know that there are those that are collectively fighting with and for you, that this is the fight of the collective, and every little bit that we do makes a difference, even though it doesn't seem like it makes a difference. Um, I'm going to lean into like I heard my dean from the School of Theology of Virginia Union preach last night, and I was so appreciative of the word that he brought out of Isaiah 50, the 50th chapter going into the 51st chapter. And it's a scripture that talks about walking through the dark path and what our call is in this season as we're walking in the dark path. And he lifted up a verse at the beginning of chapter 51, like in the midst of the dark path, we need to remember who our source is. And the scripture says something about being hewn into like the crevice of a rock. And so, and the acknowledgement that this is the isn't the first time for our people, specifically Black people, going through a dark time, and that our existence is a testimony of survival, and we've survived before. And so I just have to, my faith tells me that we're going to survive again. And part of our survival is in the collective community. We know how to bind together. We know how to make do when there's not a lot of resource. We have it in our DNA. And so we just lean into that. And so even though we are in a dark path, and it's okay to say it's dark right now, because it is, but it doesn't mean that we're going to be here always. And so for those that are getting impacted the most, I just want to reassure you that you don't stand alone, and there are those of us that stand along beside you. And so we're going to keep raising our voice for justice as you raise your voice, and the collective voice is enough to move mountains. So yeah.
Thank you. And you want to say almost at that point, like, amen. The church say amen. Because I do believe that was definitely an amen moment. Because I think you really kind of put together, like you said, what we're feeling. This is dark, it's unprecedented.
Mhm.
But we know, those of us who have been here long enough, we've been here and experienced sometimes like this. Those that have come before us, our ancestors have been through this. And so if there's nothing more, we at least know the shoulders in which we're standing on, and again, I think just the ancestral blood that runs through all of our veins of knowing kind of what we have persevered through. But um and I love that, again, that it is the holding on, but while we are holding on, this is the opportunity to equip ourselves with the information that we need, to equip ourselves with the resources that we need, because our faith without works is dead. And so while we are having and holding on to that faith of knowing that it still is all going to work itself out, but what is our work that must come alongside the faith that we are clinging to. So again, I want to thank you for that. um I also want you to let people know how can they get in touch with you, how can they connect with you, because I really do, family, like, of course, the Bomb and Gilead always wants you to connect with us and join our mailing list and all those great things, but I definitely want you to make sure that you are also getting connected to the Virginia Interfaith Center. So how can people do that?
So the easiest way is to sign up to be a part of our mailing list. We do a weekly newsletter. Our weekly newsletter is a great source of information. There's a message from me every week. We give you updates on bills that are coming up in the sessions, what's going on in the civic engagement realm, all throughout the Commonwealth, all throughout the year. So it's really the best way. And so if you go to our website, I was going to try to put it in the chat, but I didn't join the chat ahead of time, so I can't type.
That's
But
okay.
it is, and it's such a long website address. I am so sorry, but it is www.virginiainterfaithcenter.org. And so that will bring you directly to us, and you'll be able to just sign up, and you'll see a wealth of information and resources there. We are also on Facebook, Instagram, and LinkedIn. Thank you so much for getting that on the screen for me. So yes, that's the best way to stay connected.
Yay. Thank you so much. Carrie has in the background making sure that we are staying straight. So yes, family, again, just please make sure. And again, I think it even for those of you who we know are joining us from like Oklahoma, you're joining us from other states. I would still say do that because I think even though this is happening here, and Dr. Cook, executive director for this center, there may be other organizations similar to the Virginia Interfaith Center that are in your state, or you can just see what's happening here. And then you can use that to say, hey, I wonder, could we do something like that here? Could we have some type of civic engagements or set something up? And then if you really are interested in and you really want to get some help and support, then that's where, yes, you can reach out to us at the Bomb and Gilead and we can work with you to help again, make sure that you are getting engaged and staying engaged throughout the entire, this, we should not just stay engaged when election times or when it's time to go to the voting booth. This is a year round 365, 24/7 type of thing because policy is impacting our lives 365 days, 24/7. So again, thank you so much. I can't wait to see you again. I do hope you guys get, even that small window of rest coming up in May. And again, I know I'll be talking to Catherine soon to hopefully do some additional work with her through the coalition. But just thank you so much for everything that you do. And again, we will definitely, you're your family. So, we will always be probably reaching out to get you to participate, including family. We want you guys to know that in September, the Bomb and Gilead is bringing back our Healthy Churches Roadmap Tour. We have a stop this year that is going to be here in Richmond, right here in our own backyard. It is going to be on September the 12th. This event is open, it's free to the public. We're going to have, again, some great speakers and panels, including some local health priorities panel featuring folks right here from Richmond, right here around the Virginia and Central Virginia areas, talking about what's important to our communities, what our communities are experiencing, and more importantly, what we're doing to solve them. So we want you to make sure that you join our mailing list so that when registration opens for this year's roadmap, that you do not miss it, and that you can sign up just to participate. There's going to be free health screenings, including some screenings that you will not be able to get from your healthcare provider with or without good health insurance. So please make sure that you join our mailing list, and when registration opens, that you join us for that. And again, I just want to thank everyone who took out time for their evening on this Tuesday to join us. This is our first episode for this season of the Health and Humanities Fireside Chat. We will be back with you every Tuesday, every third Tuesday at 7 o'clock across all the social media platforms from now all the way until October. So we have a lot of important conversations to be had. Next month, we're going to be talking a little bit about mental health, but really looking at it from a perspective of our young teen moms. How do we build for our future for, I think, young women who oftentimes get left behind. So if you have not signed up and registered for the remaining or upcoming fireside chats, please make sure that you go over to bombandgilead.org and register for those. You can register for all of them at the same time, so that way you do not miss any. But again, I want to thank you, family, as always. Be blessed, be safe, and stay engaged. Love you, family.